It's indeed a pleasure to have you join us again on Issues and Society, a program that discusses trending issues as it affects our day-to-day living. I am Zainab Ubitin. Nigeria spends $1 billion on medical tourism every year. While Nigerian doctors are rated among the best in the world, 500 Nigerian patients seek medical care abroad every month. Joining us this morning to appraise the Nigerian health sector is the medical director and consultant orthopedic surgeon of the Alliance Hospital Services Ltd, Dr. Christopher Otabor. Join us again after the break.
With an ever-evolving society, there are everyday issues in the marketplace, in government, in our social lives, even in our homes. Issues and Society brings these happenings to you. Join us on this station. For sponsorship and advert placement, please call 081 100 00712, or better still, follow us on our social media handles.
And so we leveled our special focus on notable individuals and indeed corporate organizations that have contributed immensely to the growth and development of the Nigerian economy. With us today is Dr. Christopher Otabor. He is the medical director for Alliance Hospital here in Abuja. Doctor, it's indeed a pleasure having you on the program.
Thank you for having me.
Alliance Hospital, can you tell us a bit about the hospital? How it started and where you are today?
Thank you. Alliance Hospital started in 2011 as a specialist orthopedic clinic, and it has grown since that time into a multi-specialty hospital with a number of services ranging from, of course, orthopedics and surgery, where we do joint replacement, fracture surgeries, deformities, limb reconstruction, limb lengthening and all that, to kidney transplants. We do that quite a lot. We've done about 74 kidney transplants since we started the kidney transplant program, with over 94% success rate. And we also do brain and spine surgeries, yes, for bleeding in the brain, for brain tumors and other conditions of the brain, to spine surgery. Spine surgery is one of the commonest surgeries we do here because as people get older, there's degenerative change in the spine that leads to a lot of pain, and many times we have to do a decompression and fix, and that usually remedy the problems. We're also into general surgeries, and other specialties like obstetrics and gynecology, cardiology, pediatrics, of course. And so by and large, we are spread evenly across most of the fields of medicine. And of course, you can't render these qualities, these services in good quality without being backed up by very advanced medical equipment and smart medical personnel. So we've got equipment like CT scan. We just installed the 16 slice CT scan, and we're installing the 64 slice as we speak. The equipment arrived during the weekend. I mean, that's about $500,000. Yes, and we have MRI scan. These are versatile machines that help you scan the brain or any other part of the body with razor sharp, precision. We also have dialysis units with about 6 dialysis machines working at the same time. And we have an intensive care unit, 5-bed, fully equipped intensive care unit with ventilators and all the equipment that is required for critical care.
And so how has the journey fared since inception?
It's since inception, it's quite challenging, but very rewarding, I would say. Yeah, and I thank God that we dared to do something, because if we looked at the contending and the contrary winds, we perhaps would not be where we are. But we took a step of faith. Finance was a problem at the beginning, because nobody wants to give any startup serious money because they are not sure whether you will succeed or not. But we were fortunate. I got a facility, just 3 million naira to start, from UBA, and it was tied to my salary account at that time. So we were able to pay for the rent and do a few renovations, and I started. But for me, I thought what was most required at that time was my skill, because God blessed me with some very good skills, not just the medical skill, but people skills too. You have to be able to reassure your patients that if they give their lives to your hands, that you'll be able to secure it and give it back to them. Because medical practice, especially surgical practice, is that big. Someone is coming to you and say, I need to undertake a surgery, and is going to undergo general anesthesia for 6 hours. Yes, that's like taking a long haul flight. You have to be sure of the pilot and that the equipment is also in good shape. So with consistent good results, people have come to trust us that when you get into that hospital, you will come out alive and you will come out well.
Now, what is unique about Alliance Hospital, the sea of hospitals?
Yeah, one of the unique features of Alliance Hospital is the fact that when you step into this hospital environment, it is very clean and it doesn't smell like a hospital. Many people say they have a feeling of being in a hotel. Then secondly, when you get into this hospital, you are most likely going to get everything you need under one roof. Yes, unlike where many hospitals you have to go out to do a CT scan, come back, go out to do an MRI, come back, go out to do echocardiography, come back, go out to do a dialysis, come back, go out to do, if cases are critical, they are referring you for ICU services outside. But we have everything under one roof. And so that makes patients happy, because no matter how difficult the case may be, you would find succor. You'll be able to get what you need most of the time here. And because of the quality of our services and the range of our services, we find that we've been able to stop a lot of people from going abroad for treatment. Yes, so because these are the things that took people abroad before. We're talking about kidney transplants, we're talking about joint replacement surgery, we're talking about spine surgery, we're talking about brain surgeries, and some cancer surgeries. Those are the 5 top reasons why people go abroad. We used to do open heart surgery, but we had to stop because of a lot of issues. Our patients don't come in time. The result was not very encouraging. So our heart surgeons said no, that it's not going to proceed. So we dropped that. But every other thing, we're doing it. And in a year, I can say that we saved Nigeria upwards of $10 million.
Now, having been around in the medical field for quite a while, with your wealth of experience, how would you appraise the health sector in Nigeria so far?
Well, generally speaking, our health sector is not doing well, because there are indices that you use to measure a health sector, and they are scientifically derived. You talk about life expectancy, you talk about maternal mortality, you talk about infant mortality, you talk about even the SDG goals. A lot of them are health related. So, and we don't look like we're on track to meeting the SDG goals, even though it started in 2015. But our figures are still low. I saw that they did a baseline survey for the SDGs. In other words, where are we at the beginning, so that we can make comparison, towards the end. Yes, and our numbers are not too encouraging. I mean, even Ghana, their life expectancy is higher than ours. And life expectancy is directly related to the health system. So people still die unnecessarily. Life is cheap here. And many of these deaths occur at the primary healthcare level, where we could have done more in terms of prevention of diseases, in terms of emergency response. When people get involved in accidents or emergencies and they don't have money in their pocket, they are likely to die. Even though in the National Health Act of 2014, it talks about emergency, it's made some provisions for emergency care and all that. But that has not been fully operationalized. I see the ministers, the Ministry of Health, trying to give a teeth to that provision of the National Health Act. But it's not effective yet. So if you take an accidented patient to a hospital now, and the private or government, they are not sure who will pay for the bill, who will pay the bill of that patient, there's likely going to be a lackadaisical attitude towards the patient. They may not tell you that they will not treat. Some of us that have some level of capacity, we do treat and stabilize, and maybe we refer later. But there are smaller hospitals that don't have the resources to treat such strangers because they are not sure that they will get their money back, And infectious diseases, diarrhea diseases are still killing people, and then when you come into cancer care, a lot of people are dying from advanced cancers, late diagnosis, poor funding of cancer treatment. Most people will not be able to treat themselves if they get into the unfortunate situation of being diagnosed with cancer, because diagnosis is even costly. Then investigations and treatment, they are all costly. So we find a lot of people just hopeless, and a lot are dying every day, from diseases that some of them preventable, others can be treated. Yeah.
Now, the ethics of the profession, is it to save life first, or we look at the monetary aspect of it? Because I mean, some of your colleagues, with all due respect to the profession, it's more of the monetary aspect is against saving lives.
Every doctor is trained to save life, and hospitals will save life when the condition is right. But apart from saving life, they also have to be in existence. Because if a hospital is not properly supported to continue to save life, they can save a few lives and go under. It's better that the hospital is still in existence after saving that life, so that he can continue to save lives. Otherwise, if he throws everything he has, the owners of the hospital throw everything they have into saving life, and they were able to do that for 6 months, and they're not able to recover their funds, tomorrow they won't be there. So there has to be a balance. Yes, it's good, we want to save life. A doctor wants to save life, but he needs to be alive to save lives. He needs to be able to eat, feed himself, and be sure that his children will go to school, for him to be well positioned to save lives. So that is the balance that we need to create.
Now, research has it that a whole lot of Nigerians rather do self-medication rather than go to professionals in the health sector. As a medical professional or medical practitioner, what do you think is the cause of this, and how can it be addressed?
Well, self-medication is a big problem in our environment and in most developing countries, actually. It speaks of the disorganization. It's both individual problem and regulatory agency problem. First of all, poverty is a big problem and it's a culprit in this. When people are poor, they're thinking of how can I spend 5,000 naira for registration and consultation. I'd rather go to chemist and buy what I think is okay for me with 500 naira or 1,000 and I will be fine. And many times they get it right, but maybe from experience. But there will be time when they are wrong and their life can be on the line. And a lot of people have died, based on self-medication. Either they delayed the time they should have come to the hospital, and so they lost precious time for something that is an emergency that they didn't know, or they take the wrong medication and it damages their system and they die. Then also, apart from the poverty issue, illiteracy is a problem. Then cultural issues. Because my sister took this medicine when she had headache, so now I have headache, I'm going for that medicine. In fact, people, based on their experience, prescribe for other people. They are not even doctors and they don't know what is going on. Many diseases have similar symptoms, so they get it wrong. Okay. And then lastly is the regulation, the regulatory agencies. I spent some time in Germany. You cannot get medication except by prescription. Nobody is willing to give you. It's the same thing in the US. I mean, you can't get a tablet or a capsule of antibiotics, no matter how the story you tell. You have to get a prescription that contains the doctor's name, his number, his practicing number and his phone number in case of reference. Because they know the damaging effect of self-prescription, especially antibiotics. In this environment, you find a young man wants to have unprotected sex. The thing that is coming to his mind is that I want to take antibiotics to prevent diseases. It's so crazy. So many on professional practices. So everybody is needed on board to curb this menace. Doctors and healthcare providers, we need to speak more to our patients. The mass media need to do a lot more. Then the government regulatory agencies, they have to bring in regulations that will prevent or criminalize, this act. Many people, so-called patent medicine store owners, they have turned themselves to doctors. That's also self-prescription. And so a patient walks into the patent medicine store and say, I have headache and this and that. And then the guy turns into his doctor and starts prescribing. That's also self-prescription. So all those are unwholesome practices that can affect the health of individuals.
Now, the Nigerian Center for Disease Control, NCDC, has raised an alarm or declared that, the rising risk of Lassa fever transmission. As a medical practitioner, what does it portend, and how can this be managed, with this high risk for transmission?
Lassa fever has been with us for many decades, even before Ebola and COVID. It's just that it has seasonality to its spread. And there are areas that it is endemic in different parts of the country. So it's not a new problem, even though it has devastating effects for people who are unfortunate to be its victims. Like recently, a doctor died from Lassa fever, a doctor that was managing a patient, eventually collapsed and died from it. So those are some of the hazards that we're exposed to as medical personnel. Yes, but the advice is universal precaution. Take hygiene. We know that the vector of Lassa fever is the rat. So cover your food items. If you have a bowl of gari or rice, cover it, because if the rat gets in there and, passes his excreta and all that, or urinate there, then that becomes a high risk, and then wash your hands regularly. Make sure that you wash fruits and vegetables before eating them, and cook meat, very well. With those old, time-tested precautions, everybody will be fine. And then for the doctors, my colleagues, a high index of suspicion is very important. When you notice people are bleeding from their orifices, even though sometimes the patients have not reached that stage before they come to the hospital, find out which part of the country the patient coming from. What are the symptoms? Some of the symptoms that you didn't understand, then it's better to take precaution before you start touching the patients. So with those things, I'm sure that we'll be relatively safe. But we've not been able to eradicate Lassa fever for so many decades now.
Now, coming back to Alliance Hospital, what is your major here? You see people with this particular, looking for this particular treatment. What is your major here?
I've said that before.
In specific terms.
I've said that before. Okay, I can repeat it. We are more surgically based, though we also have consultants in other aspects. We have 4 orthopedic surgeons in this hospital. So orthopedics and trauma is one of our cornerstone. Neurosurgery, brain surgeries, spine surgeries, we are strong. Kidney transplant, we are okay there, and general surgery. So we are we do a lot of surgical cases, big surgeries, yes, but we also do take care of people's hearts, cardiology. We take care of the little children. When I say we do, it means that we have consultants in these areas, specialists, and we also have the support services. So we have consultant pediatricians, we have consultant obstetrician gynecology. Our IVF center is kicking off by next month. Yes, we are 95% complete. Yeah, so it's when you say a hospital is a multi-specialist hospital or multi-specialty center, it means that there's an aggregation of a number of specialties. Yes, but these are some of the ones that I can say that we are a leading center in the country. Joint replacement, kidney transplant, brain and spine surgeries, then limb reconstruction. If someone has a fracture and part of the bone is missing and then the leg is shortened, we can equalize the 2 legs. Yes, that's limb reconstructions, bone transport and all that. So those are the kind of stuff that we do.
A recipient of so many awards, personal and as an organization. What would you want to attribute this chains of awards to?
My secretary knows. If I were to be disposed to receiving awards, I'll be getting like 50 awards in a year. But my secretary knows once the letter comes and I write noted, that means it's dead on arrival. And I can tell you that I reject over 90% of the requests for me to get awards because I feel that it's a distraction. I haven't even achieved anything and you're bringing so much award on me. You want to distract me. And some of them too, it's also tied to finances. You give me this, I give you that. I just feel why should I buy pages on your newspaper? Why should I pay something? If you say it's an award, it ought to be something that is already merited. That means if I didn't have the money, I don't get the award. So it's profiteering, and I detest that. So the few awards, these are just a few. I receive awards from my professional organization. I receive just a few. Whatever you call many, but there are few compared to if I was open to awards. It would have been overwhelming. I won't have space to put the awards.
Well, Dr. Christopher Otabor C, thank you for making our time for this interview.
Thank you
so much.
Thank you for having me.
Well, that's the program, Issues and Society. My name remains Prosper Weaver.
Welcome back. Wow, this is a wake-up call for Nigerians who seek medical care abroad. We have the facilities here, even at the Alliance Hospital. We have the facilities, we have the doctors. Why throw our money out there? Let's make our currency strong. Let's make Nigeria great again. And this is where we come to the end of today's episode. Should you miss any of our broadcasts, you can follow us on our social media handle. I remain Zainab Obitin. See you next week.